Good morning. This is Eric Stoller. I'm here today at the American Academy of Stem Cell Physicians at our annual or biannual event here in Miami, Florida, at the Hyatt Regency. This weekend, we will be interviewing some of the doctors who are lecturing, attending, as well as the vendors and sponsors. This event really brings together some of the top experts on stem cell technology, longevity, and regenerative medicine, with opportunities not only to interact with networking, collaboration, education, but also some hands-on workshops. My objective here as interviewer, as the man on a mission, is to really find out about how we learn from these experts on the mission. They're all mission driven. You're going to find out what they do to help. If you're thinking about attending the next event, we're going to share with you why you need to come and join us for this amazing program, an amazing group. And you're going to find out more over the next day about some of the experts we're going to interview, the companies that we're going to meet. And I look forward to doing this. This is Eric Stoller, the Eric Stoller Show, sponsored by Top Doctor Magazine, Boston BioLife, Champion Mindset Events, Heads Up, our podcast partner for the show, and of course, the American Academy of Stem Cell Physicians. It's my annual event here at the beautiful Hyatt Regency in Miami, Florida, for our beautiful March event from March 20th to 22nd. This is Eric Stoller. I'll be back with more compelling interviews this weekend. How you doing? Corey, Hi, this is Eric Stoller for the Eric Stoller Show and the Man on a Mission series. I'm here today at the American Academy of Stem Cell Physicians Spring 2026 conference at the beautiful Hyatt Regency here in Miami. I have the wonderful privilege of meeting with and interviewing Dr.Mani Kukreja. She is the founder of Live Age Well Concierge Service. Sorry about that, but Live Age Well's Concierge Medicine. And she has an amazing background we're going to find out about in a moment. But thank you for being here, not only as a doctor, a scientist, an author, a lecturer, and just amazing, beautiful smile. And your specialty is in working with women with hormones.
Women over the age of 40. So I'll give a little introduction about myself.
I wanted to start there. Tell me a little about you before we get into that.
Yes, thank you very much, Eric, for having me on your show.
My pleasure.
So I'm Dr. Mani Kukreja, and I'm MD, MPH. I am Master's Public Health from Tulane University, and I'm double majored in women's health and clinical research. So I am clinically trained as a physician, and I'm also the integrative health and wellness expert, also the author of Live Age Well's Age Stronger, Live Longer. That's the name of my book. And my main niche is basically to empower women over the age of 40, especially, not to think and approach that aging is a decline, but to approach aging as a transformation in their health. And so I empower women basically also by combining my evidence-based medicine along with lifestyle strategies, wellness strategies, and I blend both of them, and I kind of just educate them. And we do a lot in my concierge practice. At my concierge platform, I deal with women more than who are over the age of 40, especially for hormones. They have a lot of hormonal chaos and fatigue and a lot of aging symptoms, which they kind of think, is a part of life, but it is not.
Keep going.
Yes, and that's what I do. So I manage their health by taking care of their peptides, their biomarker testing, DEXA scan, and also a lot of, all those health optimization techniques.
That's wonderful. And so let's talk a little bit about the hormones, because many women, as you said, they think it's decline. I hear this term also, perimenopause. and I've heard it from physicians. I had mentioned about my sister. So what's your message to women? Because they're thinking is, oh, this is natural instead of actually getting checked. And I know people have, like my sister, she got advice and it was bad advice. It was not even it wasn't even from a credible clinic. And here's an executive from a major company. So can you kind of share a little bit of insight to that and also know like, what are the signs that women should be working for that they should go ahead and get somebody like yourself?
Hormones testings, yeah, definitely. So average age of menopause is around 50, but 10 years before that, that is around about the age of 40 or starting from the age of 35 is what we call the age of, the stage of perimenopause. So 10 years before menopause, right? So I think every woman should be tested for their hormonal markers, that is estrogen, progesterone, testosterone, LH, that is luteinizing hormone, and FSH, follicular stimulating hormones. So once they know their testing and their levels of hormones, they should be managed, right? If there's any lack of hormones, they should be given hormonal treatment. So there are a lot of longevity and wellness practices nowadays, a lot, and they treat women, they supplement women all those hormones. They can be in the form of pellets, they can be in the form of stickers or patches of estrogen, and so based on your level of estrogen, they can supplement any additional estrogen if needed. Progesterone, definitely yes. They should also be supplemented with testosterone depending on what their testosterone level is, and I think that's definitely needed, because estrogen, women lose that, and we all know that when women lose estrogen, they suffer from decline in bone density, which is called osteopenia. And then if you don't treat for that, there's a lot of risk factors like osteoporosis, falls, fractures, and they cause huge toll. That gives you bad quality of life, So I think supplementing and optimizing your hormonal levels is utmost important for women, especially. It's good for your mental, the brain clarity, mental fog, your fatigue level, for your skin, for your estrogen is also cardioprotective, so it has great benefits.
And so, also one of the things as a spouse, and spouses dealing with that sometimes not knowing how, because there's a lot of up and down in the emotions, and and so, so, us as men, dealing with our spouses sometimes, like, we're not sure what to do because, is it something we did? And I've seen behavior where it's normal and it's up and down, and I definitely has to be related
definitely. That kind of mood fluctuation is a big factor, right?
Yes.
So I think, stabilizing your hormone is utmost important for health optimizations, right? Starting from the age of 40 years onward.
Now, do you find when they do the hormone optimization, because I know a lot of women wind up gaining some weight,
yes,
do you find that the hormone optimization helps with all of that in terms of keeping weight off and all of those things?
Yeah, actually, some women I know, they complain of when they start with estrogen or they start with the hormonal supplementation, they complain of gain in weight, but it's very transitional. It's very, very transitional because it's just a lot of fluid accumulation, but maybe 3 to 4 weeks. But once you are used to that particular dose of the hormones that you are needed to be supplementing with, that weight is gone, and actually it's more like a stabilization. I think it does good for your bones, it does good for your brain, it's cardioprotective, it's also good for your overall metabolism. So basically that weight gain is more like a stigma, but that's not really true medically.
Got it. Now let me ask you, like, for what you see happening in the future, because obviously we got millions of people that are aging, they're getting older. I just saw my mom, unfortunately, just passed, and she was battling Alzheimer's. And when you go to a facility, you see lots of women, and whether they get that or not, and it's all the cognitive decline, and they wind up in wheelchairs from a UTI or other things like that. So how is this also helping, like, really, like, the whole anti-aging movement?
So I think if you are managing your biomarkers, if
Okay.
you know what is going on with all those lab testing, because that's really, it's more like reactive medicine to proactive medicine.
Yes.
Because once you will go to the doctors, they're not going to be doing all your biomarker testing, all those 200 biomarkers. But I think it's very important once in a year to know all your hormones, to know your metabolic indicators, as well as your DEXA scan right after the age of 40. I think I will recommend women to be doing their DEXA scan once when they go for their first mammogram, right? And then right after the age of 50, I would love to do it every once in a year. You need to really know how your bone density is. You need to know how is your muscle mass. You need to know what is your fat mass, your visceral fat as well as your superficial fat. So it's important to know all those factors. And once you know, you can manage those very well. You need to be knowing the biomarkers, your bone density, your bone, your fat, your muscles, and then you can manage that simply.
And you said a key thing because, like you said, the osteoporosis, the brittle bones. I see it. So many seniors are hunched over.
Yes, they're hunched over. They're kind of, especially if you have autoimmune, if you have a history of autoimmune disease in your family, if you have a history of your mother shrinking, if you have a history of smoking, if you have history of taking corticosteroids for any of the illness, long-term corticosteroids exposure, especially in those kind of situations, you should be getting your DEXA scan done because then you're more prone for losing the bone density. So all those factors, it's just not that one particular factor. You have to see all those factors are mushed up together. And because, falls and fractures are the major
100%.
right. They're the major culprit when it comes to aging, and especially aging women. And if you've had falls and fracture, it's just 50% of the chances that you will never come back to your pre-fall status, and 30% of the chances that, you'll die because of the complications and the quality of life after the fractures.
So true. I know somebody had a hip injury.
Yes.
Much longer.
Yeah.
And Dr. Farshan does a lot of teaching Tai Chi.
Yeah.
And he talks about how with seniors, my father, the same thing. I even said to him, because I called him one day.
Yes.
And he was going to the phone and he tripped. He fell on his face, chipped his tooth. We had to call the ER.
Yes.
And it happens all the time because balance so important.
And I do not know how many people talk about it, but because movement is the major foundation, right, of all along with movement, your protein intake, your nutrition, your sleep, and all those are major foundation of wellness and lifestyle and health. But even when I talk about movement, I think balancing exercises are so important.
100%.
And I do that. I teach my clients, to be balancing on one leg, because when you train your brain as well as your body
Yes.
to be balancing on one leg, basically you're teaching yourself to be avoiding those falls and fractures in the later ages of your life.
Yeah, absolutely. And I think there's a big misnomer. I was talking to a woman the other day who's 82. And her friends would say to her, why do you go to the gym and lift weights? And the first thing they tell you is you should continually lift weights. I know I have women who are friends of mine who are in their 70s, and I wouldn't want to mess with them.
Yeah.
The amount of weight they're lifting, but you see the body, I think the age thing that we're in now is all in the mind.
It's mine. Yeah.
It's mine. So then when you start, I see people who are complete anti-agers.
Yeah.
A woman who's 75 that I couldn't pace up with her on a treadmill.
Yeah.
So what does that tell you?
Yeah.
Is it age, or it's really how well you're taking care of yourself?
I think
and
it's more
managing?
like, yes, managing your symptoms, managing your age, how well you're taking care. Exercise and movement. I say all the time that, when your body is into movement, your bone is into movement, is the impact exercises is every woman should be doing, because when you do impact exercise like dancing, jumping, box jumping, that is how you stimulate your osteocalcins, the osteocytes, which are the bone cells. And when your bone cells are into movement, when they are activated, not only your bones are going to be strong, but your brain is going to be strong, because that osteocalcin that is going to be activated when your bone is working and into movement, That osteocalcin actually stimulates all your brain-derived neurotropic factors like serotonins, like dopamine. Serotonin is your feel happy hormone. Dopamine is your motivation hormone. So that the brain, and there's a connection between brain and bone.
Amazing, amazing. Two things I want to ask you. First, if somebody wanted to get with you to get a consultation and find out how you can help them, how would they go about doing that?
I have a website that is manikukreja.com. You can get onto the website. The whole system is set up to be on the concierge wellness consultation with me. And it's like a 1-hour consultation. I can look at your health indicators, all your health parameters. And then from there, we can continue on.
That's fantastic. And then I know you have your book out.
Which I do not have right now.
Right, but what's the name of the book?
The book is called Age Stronger, Live Longer.
Age Stronger, Live Longer.
It's a book that's available on my website as well as on Amazon. It's Amazon's best-selling book. So go on and look for Age Stronger, Live Longer.
There you go. And so book a consultation if you're in need of help with your hormones. Maybe you're a practitioner that has clients that you don't know how to handle or to consult with. Dr. Mani can be able to help you. The other thing, too, is it's all education. And whether you read her book, go to one of her lectures, or just have her consult you. I think the key thing today is education.
Right.
And I think most people, as we were discussing, it doesn't know how smart they are. You may be smart in one area, that doesn't mean you're an expert in another. So before we end the podcast, I want to give you the last word if you were going to say something. First, how are you enjoying the conference here today?
I am just loving this conference because we are exposed and looking at the regenerative therapy. I know this is a field which has been kind of hidden.
That's right.
Yeah, but I really believe in regeneration therapy, especially for the pain management, tissue repair.
Yes.
And definitely I'm looking forward to how it is going to be turning the corners for the longevity practices.
So I want you to give me the final word of what you'd like to share with our audience before we wrap up for today.
So my final words, my message that I advocate and speak often is that life is beautiful, live it well, and especially to the women, don't ignore your health, because your health is the main foundation on which your life is balanced and based on. Your career, your family, all are dependent on how well you live your life. And so go to your doctors. If you do not find a trustworthy doctor, please look for longevity doctors, functional medicine doctors. Get your biomarkers tested. Get your DEXA scan done. Know your body, know your health, and then try to manage your health, your hormones, your metabolism, your biomarkers, your bones, your muscles, your fat, and everything is very important. Get your testing done and take care of your health.
There you have it. Dr. Mani Kukreja. Do it again. Dr. Mani Kukreja, the founder of Concierge
Live Age Well.
Live Age Well, here at the American Academy of Stem Cell Physicians 2026 Spring Conference at the beautiful Hyatt Regency. This is a woman on a mission. She's here with a man on a mission for the Eric Stoller Show, back here at the conference again. And we'll see you soon with more compelling interviews. Thank you so much for being on the show.
Thank you for having me.
Oh, and such a pleasure.
My pleasure.
And the insight that you gave us. Make sure you get with this young lady and find out more, because she is one of the cutting edge people in this industry. Again, this is Eric Stoller for the Eric Stoller Show here with Dr. Mani at the American Academy of Stem Cell Physicians Spring Conference 2026.